I really want to affirm to everyone in the Eastern Caribbean that today is a great day for British American Insurance Company health insurance policyholders. We are here to launch the Eastern Caribbean Currency Union BAICO Health Support Fund. This fund is an initiative of the governments of the Eastern Caribbean Currency Union aimed at relieving hardship for some of BAICO policyholders. The fund is something for which our people have been waiting for a long time, and they will be happy to see that this fund is finally in place. The governments of the Currency Union are pleased to be able to provide relief to a segment of the British American Insurance Company policyholders. There is a background to all this. We know that the British American Insurance Company collapsed in January 2009. And although this company is a private company, the Currency Union governments decided to intervene, mindful of the systemic risk to the financial system if this matter was not addressed properly. Our governments remain committed to assist individuals who have been hurting and to protect the economies of the region. The governments have remained steadfast in our belief that this is a regional problem that requires a regional solution. Our approach at every stage has been considered and collective, and we have kept the people of this region informed at every single stage of this process. I have been on several radio stations throughout the Caribbean. I have addressed this matter in Parliament in St. Vincent and the Grenadines on more than one occasion. I have presented speeches on it at different fora in the Caribbean, in Grenada and Antigua, for example, and so on and so forth. And the judicial managers have made information available to the public, and the technical committee headed by Timothy Antoine have put out a lot of information. Of course, I appreciate that people may not always follow the ins and outs of what we are doing, and they just simply want to hear a final solution. Well, it is not so easy to have a final solution. We have addressed other aspects of the problem before, and this is one particular aspect addressing the issue of a health support fund. As you can imagine, this has not been an easy process. It has been complicated and time-consuming. What have we been doing, broadly speaking, to get to this point of this launch of this health fund? We appointed judicial managers. Now, you may think that that's a simple process, but you have to go through a lot of paperwork, and you have to go to the courts in every single jurisdiction. And in some cases, we would get early court dates in some jurisdictions, and then we can't move completely until we have all the court dates in all the various jurisdictions. And that has not been an easy thing to get done. Though I must say that the judiciary, in terms of making the time available, that it has been fairly accommodating. They appreciate the urgency of this matter. We have established a ministerial subcommittee of the Currency Union, which I head. There's a technical core committee, which Timothy Antoine heads, and which provides on an ongoing basis the advice to the ministerial committee. On the road to here, we took the decision that a health insurance fund was necessary to provide relief to individuals with health insurance claims. We have done a review of the policies And we have worked closely with British American in Trinidad, the judicial managers, and the BAICO branches, all of whom are committed to assisting the policyholders. And we have had to work through a large number of technical and logistical issues. Well, what is the purpose of this fund? What is its mission? Over the next 6 months, we expect the overwhelming number of qualified persons who are entitled to be paid health insurance claims to get the message that the fund is open for business. The fund would be here to solve some of the problems policyholders faced since BAICO collapsed. And we expect to see a smooth, fairly straightforward and simple process for policyholders to reach solutions. I want to emphasize this point, that this is a fund in relation to persons who have health insurance. It is not a fund in relation to persons who have annuities, who have health problems, and who want payment on their annuities because they want to pay for their health and medical attention. This is about a fund for persons who explicitly who have health insurance. There is an application process, and at sometime today we will have Timothy Antoine going through the application process. The fund is officially launched today. It's officially open today. The health insurance policyholders will have access to the fund from today. I want to thank my colleague heads, members of the Ministerial Subcommittee on Insurance, the Technical Co-Committee, and all those who have worked tirelessly to get to this point. But most of all, I want to thank the policyholders who have been patient. Finally, help is on the way in respect of the policyholders for health insurance.